What's up everyone, welcome back to my channel, and if you're new here, hi, my name is Linda, a pharmacist, and I'll be your host. Today I have two guests and they'll introduce themselves, then I introduce the topic of the day. So welcome.
Yeah, so hi guys, my name is Cynthia and I'm a nurse by profession and I'm happy to be here.
Hi guys, I'm back again. My name is Naph. I'm a dentist by profession.
Yeah, so today we're not going to do serious videos. Sometimes like work without play makes Jack a dull boy. So today we're going to do like a game and we're going to do Never Have I Ever Medical Edition. So without wasting your time, let's do this. I hope you guys are ready.
Yes.
Yeah.
Born ready.
Okay, so the first question goes, never have I ever had a crush on a coworker.
On a co-worker?
Yeah, so, or even a fellow student, or even a resident, or something of the sort. It goes all the way from school until now.
Working.
She starts. Yeah.
I have many times.
Many times. Every day.
During internship, I did.
Yeah.
Of course, you once in a while you'll see someone who's handsome.
Yeah.
So yes, I have.
Yeah.
Yeah.
I also have. I feel like we spend so much time in the hospital, and then our healthcare workers don't have interaction a lot outside there. So even a big percentage of them breed in between.
Inbreeding.
Yeah.
Okay, for me it's different. I have never.
Yeah.
Like I've never had a crush on a coworker, my classmate.
Yeah.
No.
Ever?
Never. Like I feel like I'm not even attracted to anyone in the medical profession.
What?
I swear.
Yeah.
Like
Okay.
That's interesting.
Yeah.
I know.
Yeah.
Number two, never have I ever ruined a date with a gross medical story.
I don't know if I have, but most of the time when I am so into dentistry and the work we do, and I like taking photos of before and after photos and stuff. I probably have, but maybe they didn't tell me. They probably didn't tell me, but because I like to talk about dentistry a lot. Yeah, so maybe. Yeah.
I know for sure I have.
Yeah.
Nursing stories of I don't know, infected diabetes food, smelly discharge. You see now I'm doing it.
I know you're ruining it.
I have that at least. When people normally tell me, okay, now stop. We have the picture. Usually, normally when people are eating, when I come up with those stories.
It's true. Yeah, I've done that a couple of times, guilty as charged. Yeah, like especially when I was doing my clinical whatever. Right now it's rare because I'm not like doing clinical. But back then I used to like, you could find me now starting to discuss something that I saw today, like, oh my god, can you imagine today I saw this, like this is so gross. And then someone just goes like, do you realize you're on a date, you're not supposed to be discussing professional matters. So guilty as well.
I think I've ruined family dinner. For first year, I used to be so in talk about this kind of, we cut bodies. And then my mom is just over there quiet, wondering. So I was like, well, don't talk about those things.
It's true, especially the cadaver stories.
Yeah, because me used to like talk. I remember first year, after first year, the Christmas holiday. We were just there. Some of my aunts had visited and stuff, and then one of my uncles is so interested in these stories. So me and him are just like, we cut cadavers, we do what, and then everyone else is just there quiet, disgusted.
Next, never have I ever been grossed out in front of a patient.
I have. Sometimes we find some really nasty infection, but you really try to hide it. Monday mornings are not nice for dentists because people just go out and stuff and come and they forget to take care of their oral hygiene during the weekend. But you never show it.
By the way, for me too, I have. But like Naph is saying, you never show it. Like you don't start telling the patient, this one, or not hold you up. Like in nursing sometimes. I won't go into details, but sometimes you can like get a really, like in the morning when you're changing the linen or like changing the patient's, clothes. Gosh, I'm starting it. You have to put a face, but
you really can't.
You're like, anyway, but you don't show. You
can show.
For me, it happened. I think there's a word in some hospitals, like it's a surgical ward, and for people who've actually got accidents. So there's this person who had an accident like for a bicycle, and then all of this part was actually like out, and then the nurse was trying to change. And then the person was wincing in pain, and then it had Pseudomonas infection. You all know how a Pseudomonas infection presents. I reacted. Most of us reacted. Some people walked out actually of the ward. But we were told that's not nice, and you shouldn't do that. Like,
you shouldn't.
You shouldn't do that.
But sometimes
you chose the career, you die by it.
Next question. Never have I ever been attracted to a patient or a patient attracted to me.
We started seeing
don't lie.
I go first. Let me just go first. I have not been attracted to a patient. I kind of like to stick to that. But I've had moments where patients come in and they're like, "You're a handsome doctor." So you become so uncomfortable. You become so uncomfortable. Oh, can I have your number after that? So you really want to? No. They'll give you a business card, front desk. Now you make sure that doesn't have your number. It's the office number. Because you can't always entertain that.
It's true.
And you can land you into trouble.
It's true by the way.
There's a whole rule. For that.
So for me, I think I have had a patient. It was a crush, attracted.
Attracted,
A patient actually. Come to me, but this was a while back, like during my internship days. So the patient, those days, the nursing uniform. So I used to have like a nice card. So this patient had a crush on me. So when they got discharged, I think I met them outside somewhere, like a Nyamachoma joint. Then they were like, "Oh, come, let me buy you any lunch." Me innocently adjust. So they. It was like saying, he said, "You want to say thank you for the way you helped me." But he was not alone, he was like with a brother. Then I think I've also like seen relatives for patients who are handsome. I won't lie. I've seen like someone coming to see a patient, I'm like, that's a handsome looking man. But you don't have to mix. Or they come and ask me, how is my patient doing? You're like, okay. And I've also known nurses who have met their spouses that way, like relatives of.
Oh, really?
Yes. Relatives of the patient, not the patient themselves. Even some of them have dated the patients. The way you're saying it's not legal, but some of them have dated patients and it worked out or not. But yes, I have seen like relatives and I'm like, good looking person. Or someone working in the wards and I'm like, this is a nice looking person.
Okay, for me it's happened like quite, like it's repeated, like people. And that's why I get scared by they to work in the community pharmacy. Like you're dispensing medicines to someone or even in a hospital. Then the way you're explaining to this person, when I explain something, I have to maintain eye contact.
True.
But you see the way someone is looking at you and then they whisper, "Madam, unaweza nisaidia namba yako?" Then you're like, okay, really, like we're supposed to be strictly professional. You're not supposed to be doing this. So, okay, like there's an instance where I told that person, like, no, this is not allowed. Then the person got mad and walked away. Then went to the next person, like he said, this person is not going to serve me, I'll go to the next person. So it's a bit of a challenge, but
I can imagine.
Please.
And you've never seen any patient like coming there and like handsome? You thought, this is a handsome. You never.
Doc.
For real. No, like for real.
Two people who are being
maybe the type of patients who come to see me are not my type.
That could be a thing.
Alright.
Then, never have I ever doubted that I'd make a good doctor or a nurse.
I have. Imposter syndrome is with everyone. You always doubt yourself. But if you rise above it, it's such a good place to be at.
Me too. I have, of course. Even up to now, there's sometimes like you're given a task and I'm like, will I be able to do it? So I have.
Also, I have, especially the first time I encountered that, when you're in high school, you're used to like you're the top. All that. And then you come to campus, physiology will humble you.
And then the guys are hitting 90. And then you're
at the cutoff. It is like in our time there used to be this red line that separates people who actually are above 50.
Yeah. Oh, they used to do that for you.
So they do like a red line. Ooh. So my time, guess what? Who was leading just below the red line?
Yeah.
Yes.
Yeah.
So that made me like realize like, are you really going to do this? Like, Then you start like self-doubt, but at some point you just like pick it up and you're like, if this person has made it, then I will make it.
Yeah. Or sometimes you do a difficult case. Say for me, you do a difficult case. You've done your best, and that patient was satisfied. You're like, I just gave everything I had. So that day you just go home and you're like, you're even going to be, can I just quit this dentistry thing? But
or even as like in the pharma industry, by the way, you see for us, like when you're doing drug registration, there are like key performance indicators. So sometimes when you don't meet them and then you have that conflict with your boss, it's like, okay, am I really fit for this task or not? Like it comes once in a while, but with time you realize you're actually good at what you do.
That's true.
Yeah. So next question, never have I ever been consulted online for free.
Hey, me every day. If I turn those consultations every day into money, I'll be a rich man. I swear. But then, for me, I don't mind doing it sometimes. Because even if you have to, you don't have to come see me. It's not like you can just take a drug at home. Or if you have to remove a tooth, you'll still come. But then I'll still charge you for consultation when you come. Yeah, so you don't mind because sometimes it's a way of getting some patients. But some people just really want to talk about their uncle, their aunt, their grandmother has all these diseases. Hey, come to the clinic, we talk about it. Yeah. So I get a lot of people asking things online, but I like to answer. But I always say, it's catchy. I always say, but lazima kuja kwa clinic. But you have to come to the clinic.
At the end of the day,
And then you see like most doctors and people put a disclaimer. Most medical they say don't consult me on Instagram or don't ask for medical advice on things. For me, I have, but not the serious stuff. Maybe just like my kid is having surgeries. It's just the basics. And most of them I normally tell them, you know what, go ask. So like if it's a drug related something, I tell them go ask. So and so, like a specific person. If it's a teeth, I refer them to your page.
To me now. That's nice.
For me, I've also got like a lot of consultations, especially now with YouTube and everything. When I post, I post on like Facebook, so I get a lot of like DMs. There's this time I was doing a series of infertility, so I was getting like a lot of questions. And then some questions I'm not even in a position to answer them. Then when I tell someone like, please go see this person in this clinic, they don't take it lightly. Like someone thinks you have the knowledge, but you don't want to help them. Sometimes it's about the scope of your practice. There are some things like as a pharmacist, I wouldn't be able to answer honestly.
The same thing as a dentist. There's some things you can't answer because people tend to ask you about maybe general body health and stuff. So for that you just have to ask them to go to a hospital or you refer them to someone else.
Even on the side note, there are just these people who come to your DM, hi. Someone just says, hey. Hi, or hi doctor, then you're like, should I respond? Should I just leave them hanging?
But I don't know what you're supposed to say.
What are you supposed to say, by the way?
Like, you just say hi, go to the point. You know, like, go to the point. If you're throwing your shot, sawa. If you're saying hi for a consult, sawa. But just say hi and then what?
Exactly, Anyway. Next one, never have I ever contradicted the advice I give to my patients.
Why did you change your tone?
Guilty as shit.
Have I? I think I make a guilty. I don't know if this is the right context because I always preach to my patients you have to brush twice every day. Once or twice I forget in a week. But so that you can't forget. You can be tired or you're watching soccer and you sleep on the couch. Then after that you go straight to bed. But probably you forget that.
Of course, me too. Many times. In fact, I don't think I follow the advice. Sometimes I feel like we give them textbook you need advice like what like do this but
in reality
you won't do it when like in reality. I don't know, eat veggies, I don't know, eat this, especially the pregnant women, like, work out, be healthy, but you
work out.
No, at least there I practice what I preach.
You actually work out
daily. Daily. That I
every
practice
day.
what I
Is it
preach.
hard?
Yes. No, imagine just 30 minutes a day. Like you just have to wake up 30 minutes earlier than
New Year, new me. I'll start working out in February. You know, I always have these things that start on the first day of the month. So now January sharp, so February 1st.
So February 1st. Okay. Yeah, for me it's mostly medical related advice. Like you tell someone, don't take this medicine and drive. Why? Mimi ndio hiyo cetirizine or something. Yeah, there's a day I actually did that. I had a very bad, like you see this flu that has been going around. You really need cetirizine or something of this sort. So you take, and then the effects that you get. There's a day I was at the verge of actually sleeping on the stairs. Which is very dangerous. So such like things. You only understand when you're in the position of that patient. Like I tell you, don't take this medicine and drive, but circumstances.
I can imagine.
But follow what we say, don't do as we say.
Follow our words, not actions.
That's true.
Never have I ever learned about a disease and convinced myself I have it.
It's actually a thing, they're called well-aware patients or something of the sort. And then you have those symptoms. If you thought I was gonna die, I have actually done that.
Like you Google and then you think, oh, this are what I have. So you believe it.
Or not even Google, like in a class setting for me. Like there's a time we're being taught about like heart disease. Then all of a sudden you start developing like angina.
Feel that,
like you feel that's pain. You feel it, and then you're like, okay, am I becoming now this?
Am I becoming that patient? Are they talking about me?
It's true. I've experienced that like a couple of times.
Same,
yeah, me too. Even Googling symptoms and thinking I have the symptoms.
Or you Google, you have a headache, brain cancer. Brain cancer. Or COVID, yeah.
COVID was bad. When I got COVID, during the first days of COVID, I swear I thought I was going to die. I didn't have any symptoms, but because not everyone was coming up with all these things, like you don't have this, you get this, you do what. So I thought I had all those things, and I actually didn't have all those things. But then you can actually, you can actually get sicker from stuff like that.
I hope you've actually liked this video. I know you've liked it. Please give it a thumbs up, and then if you have any interesting thing, just let me know in the comment section. And then also I'm going to link Cynthia Mutisa's YouTube channel in the description box. Be sure to check it out. Dr. Naph, his Instagram and TikTok account, I'm going to link it. Please go follow him. Thank you so much, and I'll see you in my next video. Bye.